Hey, well, thanks everybody for watching this video. This is the weekly update for our COVID-19 response for Kenya. It's Tuesday, April 14th, and today I've invited Claire Nyambati, Dr. Claire. Most of you know Dr. Claire for those of you that have visited Kenya have probably met her. So she has chosen to give us some time this afternoon to talk about what's happening in Kenya, and so you can hear it directly from her. So, Claire, how you doing?
I'm doing good, Kat, and nice to be with you today, and the rest of you.
How is Tyler? Everybody wants to know how Tyler is.
Tyler is doing good. Mommy needs to acquire some homeschooling skills. Crazy, but we have to do it.
Yeah. Well, you know, we're all struggling with that here too. For us, those of us that have, I don't anymore, but have young children in our house, we're all trying to homeschool, and so I think it's another global problem. But thanks for taking the time with us, Claire. Let me just jump right into it to try to keep our time as brief as possible. So last week I shared with everybody here that President Kenyatta came out with a public address. He restricted travel between certain counties. Face masks are now mandatory. I'm just curious if there's anything that has changed Kenya-wide, any other government policies or things that have been put in place. If you could update everybody on that to start.
Okay, apart from what he said last week, the new updates, I can talk about one of the counties where our community is, where Q and Gamba is. They have actually restricted any movement of food items from other counties. And as a whole, nationally, the wearing of masks is mandatory for all who are in public places. And obviously, with the restriction that we have had of movement of food stuffs from one county to another, we are following up to find out if that would affect the other counties where our other communities are, because then that would mean we would need a new approach to any food distribution that we would have to do in the future.
Okay, good. So what's the current status right now around confirmed cases, number of fatalities related to the virus, recoveries? Where is Kenya at these days?
Mm-hmm. So as at now, we have 208 confirmed cases, and 9 deaths and 40 recoveries. There have been conducted 8,123 tests so far. And as of today, Kenyan government through the Ministry of Health began the mandatory testing of healthcare workers across the country. So as of today, they started with Nairobi and they plan to roll it out to other countries. Now, as you can see, the mandatory testing for healthcare workers will only be done for the healthcare workers, but the mass testing, due to lack of enough tests, may not be possible probably in the next coming weeks, and therefore the numbers that we are seeing could increase exponentially when the mass testing is carried out countrywide.
So today, though, there are, can you give us an update on the proximity of confirmed cases near 410 Bridge communities? Is it still, just give us an update on like where is the virus compared to where 410 communities are?
Yep, so currently the virus is in 18 counties, and only one of the counties only one of the counties, that is Makueni County, has not been affected or have not been reported any confirmed cases so far. We have a community called Irigidadi where one suspected case had been identified and is currently on quarantine at home. He is stable, a young man, and he's entering his second week of quarantine. And by next week, we should be able to get official communication from the health officials on whether or not this is a confirmed case of COVID-19.
And Makueni County is where Q and Gamba are?
Yes, that's where Q and Ngamba are.
Okay. So if there are not any confirmed cases in our communities, tell us a little bit about the food scarcity issue. We have been trying to raise support, and I know you've been distributing food kits to the most vulnerable. Give everyone a sense of why that exists, why that problem exists, even though there are no confirmed cases in the communities, and what we've been doing about it.
Okay, so the moment that we had a confirmed case in Kenya, and seeing what we had learned from what other countries had experienced, the first thing that was done was shutting down all the marketplaces. Now, what shutting down all the marketplaces means is that community members are not able to access food that they would need, meaning that there would be a shortage in the long run. And so with the church, the local church driving the efforts to be able to identify the first priority group in the communities, and that's the vulnerable groups. That includes orphans, households led by children, or widows, and special need cases. They were able to come up with a list across all our communities and identify these groups for us. And through the church, we were able to conduct the food distribution. And I would say the positive impact about the food distribution so far is that it was not just about the physical food, but also entailed aspects of the spiritual food because of the involvement of the church. We also had the health officials help us with the demonstration of hand washing for each and every beneficiary who was reached out through the food distribution. So they were actually learning how to wash hands in the right way so as to prevent the COVID-19. And another measure that was taken is working with the community health volunteers who helped us also send out messages and educate the vulnerable groups that would come into the center to receive the foods.
So what's been the reaction in the communities? What's been the reaction with the local governments? Are we working in conjunction with them, separately from them? Can you give us an update on that? Yeah,
so the local administration had been aware of the food distribution, and they were with us on the days of the food distribution, that is the chiefs, and they were able to help ensure that we were actually adhering to the directives given by the government of Kenya. And they commended the 410 Bridge using the churches as the hero in the local community, and also keeping the directives while distributing the food. And I would actually directly quote one of our chiefs in one of the communities who said that they have never seen such an organized food distribution in their entire administration work. And I would say it's a very positive comment coming from a local authority in commending the 410 Bridge in the work that they did together with the churches, bringing them as the front line in the response to COVID-19 in the communities.
So what are you doing to make sure then that the people that need the food kits the most are the ones actually getting them? What's the process that your staff and people on the ground, the churches, are doing to make sure that the right people are getting the right food kits?
Okay, so as I said, it's the church that has led the efforts of identifying the vulnerable groups, we first started with identifying the people in the congregation, and then the churches went out to the second category, that is outside the congregation. Each of the persons coming into the distribution center had to have a verification process go through. And for those where we were doing the household distribution, the verification through their identity cards was also done to ensure that the person who was listed in the group, as a vulnerable group member, actually gets the need or the food that they needed for distribution.
Great, Claire. Thank you for that. I think we've distributed close to 2,000 food kits. I don't know that those have all been distributed actually to the families yet, but it's about 10,000 people. Is that sufficient? I mean, what do you see happening and coming up over the next few weeks, several weeks?
Well, the food that was distributed would last for, a certain number of weeks, maybe 2 to 3 weeks. And thereafter, looking at the overall situation, and how we predict the crisis to be, there will definitely be an increase in the pricing of foodstuffs within our communities. And with the closure of market, obviously food shortages. And we are looking at community members who had not benefited from the food distribution needing food distribution. And that is a path that is likely to happen because with high pricing, people losing their jobs, not being able to work, and an income, the likelihood is that community members will be hungry at some point if they do not get access to food.
Okay, and that's a much bigger task than just the most vulnerable in our communities. So that's certainly something to pray for you, for your team, for our leaders in our communities. Speaking of that, give us a quick update, if you can, on our staff. How are they doing, and what are you doing to make sure that they're protected while they're trying to do what they can?
Everyone in our staff is doing good. They are staying at home and keeping safe. Whenever they are outside the house, they are adhering to the directive of wearing masks. And we continue to meet up with them and just encourage them daily with daily devotions. So everybody gets a chance to share devotions so that we're encouraging each other even during this crisis. Yeah.
Well, great, Claire. Thank you. Thank you for that update. I'm just curious if there's anything else before we sign off here, if there's anything else that you wanted to share to your friends on this side of the bridge. Any last thoughts?
Yeah, I just want to thank you all for the donations that you're making, regardless of the current financial crisis that we're going through globally. Thank you so much for your donations. Thank you for your encouragements that we continue to receive. Thank you for your prayers. And we ask that you continue praying for us, please, on the ground, because right now our community coordinators are the front line for us, and they're working very hard and just for protection and for blessings upon their families.
We'll do that, Claire. We're asking people for that all the time. So thank you for your time today. Appreciate it. Please send our best to all of our staff, all of the leaders, the churches in our communities, and everybody. We're grateful for everything that you guys are doing.
Okay, Kurt.